Hello everyone. This video are being made by us, the student under Faculty of Administrative Science and Policy Studies, for our lecturer Dr. Soon Yew on our case study of how Ministry of Health MOH managed COVID-19 pandemic in Malaysia.
The COVID-19 pandemic is originated from Wuhan, China. The epidemic spread has affected numerous nations before the World Health Organization (WHO) declared it as a pandemic. In December 2019, the first cluster of cases showing signs of pneumonia of unknown cause. On February 4, 2020, the first Malaysian was confirmed with COVID-19. In each state of Malaysia, 34 hospitals and screening centers were specifically designated by the Ministry of Health (MOH).
Planning encompasses tasks such as setting goals, strategy definition, task outlining, and activity identification to achieve the organization's objective. Ministry of Health Malaysia, using strategic planning and operational planning, which is standing plans to manage COVID-19 in Malaysia. Strategic planning is a process through which a company determines how to improve its long-term performance and takes the necessary actions. Ministry of Health Malaysia (MOH) utilize 3 tiers of strategic planning, which is corporate, business, and functional plans. Strategic planning. The organization evaluates and improves its purpose, objective, ultimate aim, and policies for the present and future as part of this process. Operational planning standing plans addresses organizational concern, challenges, or procedure. Policies serve as general guidelines for organizational decision making, while procedures are more specific instructions or rules for managing routine organizational actions.
Organizing is the process of identifying and grouping the work to be performed and establishing relationships for the purpose of enabling people to work more effectively together in accomplishing objectives. For example, WHO, which is World Health Organization. World Health Organization (WHO). It is a global coordinating agency for the response to the COVID-19 pandemic. It works with member states and partners on all aspects of the pandemic response, including developing guidance, coordinating vaccine development, monitoring daily case numbers and trends around the world. Thirdly, provides global coordination and member state support on vaccine safety monitoring and leads work to improve global capacity. Last but not least, it meets some procedures to prevention from COVID-19, which is wearing a mask, clean your hands with hand sanitizer, keep safe distance from others, and dispose of used tissues and masks right away. The importance of organizing is promotes effective communication, which is creating coordination and communication among the various departments of organization. Next, benefits specialization. process of organizing groups and subdivide the various activities and jobs based on the concept of division of labor. Last but not least, efficient administration. This establishes coordination between different departments, which leads to unification of effort and harmony in work.
Now, I'm going to explain to you guys the strategy of managing the issues of COVID-19 by decision making. Firstly, what is decision making? Decision making is the process through which managers and leaders identify and resolve the problems and capitalize opportunities. It involves assessing different options, weighing their pros and cons, predicting potential consequences, and will ultimately arriving at the choice. However, these choices that are being made could sometimes have a critical impact on personal life and organizational lives. There are two types of decision making, which is program decision and non-program decision. On 18 March 2020, the first phase of Movement Control Order, or we could known as MCO, has been implemented by the Malaysian government. MCO is a series of restricted measures to control the movement of people within specific regions across the country to control the spread of COVID-19. The second strategy is economic stimulus package. Economic stimulus packages are being introduced to help those who have been affected economically by the COVID-19 pandemic situation. For example, economic stimulus package that is worth 20 billion ringgit Malaysia has been introduced on 27 February 2020, and Prihatin Rakyat Economic Stimulus Package with the worth of 10 billion ringgit Malaysia has been introduced on 6 April 2020. The third strategy is the Prime Minister of Malaysia at the time, which is Tan Sri Muhyiddin Yassin, has introduced vaccine, to be exact is Pfizer, to the public on 16 February 2021. The Malaysian government gave the vaccine freely to the public to ensure that a group of immunity can be formed in order to break the COVID-19 chain. Lastly, standard operating procedures, or SOP, are being made by the government. For example, MySejahtera, social distancing, wearing a mask, and disinfecting public places. This is to provide a compulsory and informative practices to reduce the risk of spreading COVID-19.
Controlling is one of the fundamental functions and can be defined as a process of monitoring and evaluating performance to ensure that they are aligned with the predetermined goals and objectives. According to this definition, leaders must establish performance standards that include measurable criteria or benchmarks to determine whether goals are being met effectively. One of controlling strategy. During MCO phases 1 and 2, the government implemented strict mitigation protocols to contain the spread of the virus. Educational institutions, places of worship, and unnecessary sectors were closed, and travel was prohibited unless justified. Police and military departments collaborate to construct roadblocks at state and district borders, preventing both Malaysians and non-citizens from travelling within the country. Second, the government and the Ministry of Health collaborate to reduce infectious disease transmission, protect vulnerable populations, and minimize the impact on medical services and society by offering free vaccinations and boosters. However, as of October 31, only 51.1% of Malaysians received the first booster shot, and only 2.5% received the second booster. Last, the World Health Organization (WHO) declared COVID-19 a pandemic on March 12, 2020, due to an increase in global cases. To mitigate the pandemic's effects, the WHO recommends social distancing measures in workplaces, schools, and childcare, advising citizens to avoid physical touch and minimize large gatherings and attendees per gathering.
In conclusion, the Ministry of Health has already worked hard in managing the COVID-19 pandemic in our country. COVID-19 is a threat, as evidenced by the growing number of cases and the devastating impact on our country's economy. resulting in the depreciation of the Malaysian ringgit and a decrease in gross domestic product. For this organization to remain effective in its ongoing mission to combat COVID-19 in this country, all its weaknesses must be fixed and all its strengths must be strengthened.